Hello, good morning. My name is Javier Ceballos, and today's day is August 22nd, 21st, 2023. And the class is Anatomy and Physiology 240. This is the second part. So today we are going to dissect the reproductive system of a male and female uh, pig dissection. What I have here is a male pig. So it's a little bit dry, but I'm going to show you what I can here. This is the umbilical cord. This is the umbilical cord right here. The original opening is this part. As you can see, this is a male because the originital opening is right here. The scrotum is this part. As you can see it, this is the scrotum. These are the bags where the testicles are, as you can see here. And this is the testis. I already pulled it out, but it gets so dry. So this is the testis, as you can see here. This is the epididymis right here on the back. Testis, epididymis, and this is the ductus deferens, or spermatic cord. This is the spermatic cord right here, that it comes all the way down to the penis. Okay, this is the penis right here, the penis of the pig that connect to the ductus deferens, and spermatic cords are this right here. As you can see, they go around the bladder and around the umbilical arteries. They go all the way around to connect to the ductus deferens. And as you can see, maybe you can see here better, this is epididymis, the testis, the scrotum, and this is all for this is part of the large intestine. So I'm sorry, I apologize, it's a little bit dry, but this is all the reproductive system on a male pig. And now we're gonna talk about the disease reproductive system, but this is gonna be on male disease called uterine fibroids. Uterine fibroids, or also called myomas, they are growths to develop on the muscles tissue on the uterus. These fibroids, they usually appears on the childbearing years for a female. These fibroids, they don't know how they grow up. They expand the uterus that it can add weight into females. Some of these fibroids can be small, like seeds. Some others can be as an apple, and some big can be as a grapefruit. The symptoms that these fibroids can cause on females are heavy periods, which means they bleed a lot. It's like fullness on the pelvic area and pain. And fibroids usually grow in the smooth muscles and connective tissue. So that's where the fibroids grow, in the smooth muscle and connective tissue in the uterus. Some cause of these fibroids, as I say, they don't know the cause of the fibroids that grow in the uterus. Some people believe, or some science believe, these fibroids they grow because of the hormone at the females called estrogen. So since the females are younger, they are high in estrogen. Once females getting older, the estrogen decrease and the fibroids kind of shrink. Um, Treatments for the fibroids, there are a lot of treatments. For example, they can go under surgery and to remove the fibroids. This surgery is called myectomy. This myectomy is a cut across the belly, like around the bikini line. That's why they call it bikini line, because they cover it up with the bikini. So they remove the fibroids, but they tend to grow back. Another one you can do is IUDs, the release hormone to release the heavy periods or the bleeding. Also, they can give iron supplements, because when they have heavy bleedings, some people tend to have anemia. That will help with the iron supplement. Uh, some doctors can give pain relievers to help a little bit with the pelvic area pain. Sign of fibroids in a women, well, usually, as I said, they start having uh, heavy bleeding periods, fullness, abdomen pain, and pelvis pain. Usually they have this pain when they bend over or do heavy exercise. Some exams the doctor recommend to find out that females have periods are ultrasound, sometimes MRI, hysterosalpingogram, and hysteroscopy, and endometrial biopsy. I think those are the exams that the doctor recommend to find fibroids. But with a simple ultrasound, they can find out the fibroids. As I said, these fibroids, they are on the they go on the childbearing years on a female, and they shrink after the menopause, because the cell estrogen decrease on menopause. That's all. Thank you. Have a great day.